The landscape in oncology is changing and people need to know what's going on, so it's all about communicating with one another. And this is exactly what this did today.
The event tonight really kind of opened my eyes, and I thought it was fascinating from all the different perspectives and people's different experiences of cancer.
Patients, people with personal experience dominated the panel, and that's something that really is important as we move forward.
I hated using the word cancer because although I did have cervical cancer, it made it sound so much worse than it actually was.
There are new treatments coming online where longer-term survival is a prospect, and I think we need to tool patients around the different landscape of cancer.
I think there are many challenges for healthcare professionals, particularly around cancer, keeping up to date with the developments, ensuring that people affected by cancer have the right information at the right time for them.
We're at a time of fundamental change in our understanding around the disease, the way we assess it, categorise it, and when we think about it. Has the language kept up? That's the question that I have.
I feel that it's changed primarily because of the way that we diagnose the disease. Like, the world of science has changed dramatically over the last few years, and it means that we can take a far more molecular approach.
Things I've seen on immunotherapy treatment now, and what I'm learning from talking to practitioners, developments are happening fast, but the pace of change could be a lot faster.
Doctors are trained to suppress the immune system in cancer, but we're living in a world now where we're completely turning that on its head, and the very thing that we thought as the thing that had to be suppressed is now the very thing that we are using to our advantage to treat cancer with immunotherapy.
I was lucky enough to have a very positive treatment and cancer outcome, but communication is probably one of the biggest things, and maybe a little bit more empathy and respect for the person with cancer and how they go about it, how they like to manage their own cancer.
I think it's really important that people feel supported, that they know where they can go for information, and that they have the best possible treatment that offers them the best possible outcomes.
The landscape is changing rapidly, so we've just got to have a pace that keeps up with that change. We've got to keep doing what we're doing, we've got to keep talking to each other, and, as I say, keep sharing best practice.